Let's focus on the sacro-iliac joint, or some people refer to this as the SI joint. So it transmits the weight of the body to the pelvis. It has very strong ligaments that were covered in a previous video. And movement still occurs, but it's very small. And some males actually have fused SI joints. So this is your pelvic girdle. So you have the sacrum, one os cocci and the second os cocci. And this right here on this side and on this side are your sacro-iliac joint between the sacrum and the ilium. The movements of the sacrum, again, are very small, and they're called nutation and counter nutation. So nutation is almost putting in like an anterior rotation, which puts the lumbar spine into more extension. Counter nutation puts the spine flatter or pushes it into lumbar spine flexion. The pelvis in general, so the full pelvis, os cocci and sacrum, so the entire pelvic girdle, can do anterior tilt and posterior tilt. So if you're standing, it's just a motion of kind of like sticking your tush out, or what they call duck butt. That would be anterior tilt, or tucking your ischial tuberosities in, and that would be posterior tilt. So anterior tilt is on the left, and it's when your spine goes into an anterior direction and resulting in a lumbar spine extension. Posterior tilt moves posteriorly and kind of flattens or fluxes your spine. And we can see this with muscles. So anterior tilt, what's happening is it's the iliacus and the psoas muscle kind of pulling down on the ASIS anteriorly, and the erector spinae pulling up and just kind of rotating that pelvis anteriorly. Posterior tilt is a pulling down from the hamstring muscle group and a pulling up of the rectus abdominis, and that's pulling you into posterior tilt. Few other motions of the pelvis, you can laterally tilt it, so you can kind of go to the right or to the left. You can also rotate to the left and to the right.